So the day that you had sex, that you're like, okay, this is the day I had sex and I'm worried about this sexual act that happened in that day. You should do a pregnancy test 4 weeks from that date.
If you get an abortion with your partner, is there a way for someone to find out?
All these people who are just recklessly having sex and then they're getting abortion, like it's nothing.
Very harsh on young teenage girls.
Oh yes.
My name is Karishma. I'm a sexuality educator, and this is a series where we unlearn and relearn all those common myths, misconceptions, and questions which really should have been part of the talk. Hopefully we got it. Welcome to Talk You Never Got. Hello everyone. I'm so excited today to introduce you to Millie. And we're going to be talking about a topic which is quite taboo and really important, needs to be discussed more openly, abortions. But before we get into that, please go ahead and like this video, subscribe to this channel so that you make sure you do not miss any of the videos that are coming out in this series. So before we start, Millie, I'm going to ask you a question. If sex were a food, what would it be and why?
I think I'll have to go with my favorite food. It should be momos.
Momos!
And I think that would work for sex as a food because it's in proportion very cute in different styles and different decorations. So assortment of different types you can get. So this can relate to, different types of sex that exist that everyone likes to have. And it's juicy.
I love that. And spicy, with the spicy sauces and stuff. Oh my god, I love momos. And people eat so many momos in India too, right?
Yes.
So, okay, love it. So tell us what you do, Millie.
So my name is Millie and I am a medical student at the School of Public Health School. My personal life and academia life really are married well together because in all around, I think for me, I'm someone who works in the sexual reproductive health space with a special focus on menstrual dignity. And so I also run a menstrual dignity organization apart from that.
Awesome. And Millie and I have had such a fun time organizing events at Harvard
we have.
related to pleasure. We've worked on projects together and I can't wait for you all to hear from her. Cool. So has there been a moment in your life where you've been like, damn, I wish that was part of the talk that you never got?
I mean, so much, right? Like, what do we actually get? I think it's an easier thing to say about what things we're not receiving because there's just so much of it. I think any talk that I have ever gotten would be maybe like a random talk in middle school about, it's coming around the corner. And so I was already in the States when I got this talk from my school, and it was essentially all the female-bodied people. We were all the girls. We were taken to a room, and then I don't know exactly what they did with the boys and the way they were separating us. I don't know exactly what they did, but for us, we watched a movie it was like a birthing movie.
Oh wow!
Yeah, so it was like a birthing movie, but it was just it wasn't like, here's a person who wants to be pregnant, and then and then here are all the things that I can see how that might be in fact a movie for someone to watch. It was literally just someone giving birth in a hospital, and it was just the most aghast thing that we're watching. Not because it's birth, but just the way that it was set up and the way that you could see on the screen. They're like if you want to avoid this now, just don't have sex. And it's funny how a lot of people reference the Mean Girls references with their sex ed stories. They're actually quite true, as I'm sure you know.
My God, you literally had someone who said, if you have sex, you will get an STD and you will die. That's the line. That's the line from Mean Girls.
Essentially that, and I think and also looking at the fact that there were a lot of people in my high school who were pregnant, and this is a reality in a lot of high schools. In the
U.S.
In the U.S.
Yeah.
And in other places.
In other places
worldwide.
too. Interesting. Okay. And has there been a time in your training or practice where you realized wow, I wish we were telling people more about this particular topic?
Again, so many, countless, but I think some things that I always go back to is doing a lot of this work for me here was, menstrual education was something that was never taught to me in a way that I understood it, or in a way that was affirming and dignified and not laden with shame and with discriminatory perceptions and practices that we have globally about the idea of menstruation, and then circulate that to menstruators, right? So you see the downplay effect of that is the fact that we have such pervasive secrecy, a lot of discrimination, and a lot of like stigma and the cultural powers that consider menstruation and everything else related to that, like sexual reproductive health, like abortion. All of these are very centered around this discriminatory practice and the ideas around it, right? So a lot of conversation I'm having with patients in the urban cities of like Oakland and of Sacramento is the same conversations I'm having with, like when I did a lot of work in rural Nepal. There's something inherently wrong.
It's the patriarchy. So let's get to it. Abortions. Can you walk us through, in simple terms, how an abortion actually works?
Sure. So, I think so there's a variety of different types of ways someone can have an abortion. One is like the surgical, and then we hear about medication abortion, right? The medication abortion is traditionally done with mifepristone and then misoprostol. So the first pill, mifepristone, that is an anti-progesterone pill. So it's blocking the hormone progesterone, which is needed for us to maintain the pregnancy. That's the second hormone wave that comes around after you're ovulated. Then in order for it to grow in your uterus, you have to have progesterone. Not to get too much into the science, but that's what your body is supplying in order to try to maintain your endometrium, which is like the lining of your uterus that sheds during pregnancy. And so that's what is blocking. So it's like stopping the development of the fetus any longer after they take the first medication. If you didn't do that and you did it through the clinic, then you would need to take the first pill with the mifepristone.
Yeah.
And then the second pill you take like 24 to 48 hours later, depending on if you're doing it orally through your mouth or vaginally. That the misoprostol is a uterine tonic. It's basically just something that helps your smooth muscles in your uterus contract. You have one medication that stopped the development of the fetus, and the other medication now is going to make your uterus contract so that you can then expel the whole uterine lining.
So when it comes to taking those pills, why is it that sometimes people are told do it under a doctor's supervision, and at other times people are doing it self-managed?
Percentage of people do it self-managed, and that has increased obviously in the last couple of years due to like the overturning of Roe v. Wade, along with COVID, so it was a lot of like inaccessibility.
Right. So like basically in the US, some of the laws changed around abortion being legal at all. And so people had a really hard time accessing abortions, right? It became illegal for providers to give them, and it became illegal for people to seek them out, right? That is not the case in India, thankfully. So I guess like part of it is also, one is like, I think access, like literally, can you go to a doctor? Yeah. But then I guess the second question is like, if you have the option to find and go to a doctor, would you recommend doing it under supervision, or does it vary?
So I think it really varies. So 8 weeks is actually the most effectiveness if you go down to the nitty gritty of the actual medication. Right. But when we say about 10 weeks, 10 weeks and below, there's like, I think we're still at like a 99 to 98% success rate. When I worked in Planned Parenthood, we did it up to 11 weeks for the pill abortion. But after 11 weeks, we did recommend that you do a surgical abortion.
Gotcha.
It's just because if, let's say that the medication, it does not work in terms of the like expelling of all the uterus content, then what's going to happen is that you're going to have to either do the DNC, which is the dilated and curettage. That's what it means.
What is that?
I know, it sounds kind of scary. it just literally describes the procedure. It's just dilating your cervix so that they can put an instrument there so that they can take out the contents of your uterus that do not get expelled because you're a little too far along.
I think one of the things I've also heard from people when they access abortions in India is like they go and then they also have to do an ultrasound or maybe like a pregnancy test at the doctor's office just to fully confirm that they actually are pregnant. So actually that brings me to the question, like, how can one know whether they are actually pregnant, right? And the second question is like, you mentioned a few weeks here and there. So how does one count like when those weeks start?
Yeah, so without even going into it, we'll just say that there's things called gestation weeks, which is like, how many weeks you are pregnant. But then there's like the conception days that if you count it from the first day of your last menses.
So you're not counting from the missed period. You're counting from...
So in general, we are counting from the missed period, which is which way we say like the first day of your last menses.
I see.
Is the first day of your last menstrual period, right?
Yeah.
But that would mean they're counting the week of your menses as well as a week of gestation. So how is that possible? What I would recommend is, I think it's something that like science backs up, is from the day of the conception that you're worried about. So the day that you had sex, that you're like, okay, this is the day I had sex and I'm worried about this sexual act that happened in that day. You should do a pregnancy test 4 weeks from that date.
Gotcha.
And if there's multiple dates, then now you'll have to be strategic and figure out which was the day that was the latest. So then you can do 4 weeks from that time period and then keep on going.
Gotcha. We've talked about like the medication-based, pill-based abortion. Now let's talk about the other option, which you said was like
Surgical.
Surgical. Yeah.
The most common way that we do it now, this is called manual vacuum aspiration. And then the other twin to this is just an electric one. And that just means that you just use like an electric vacuum rather than like a manual one. But essentially they're just creating a little dilation in your cervix again. And then they're using a tool like a vacuum to aspirate, meaning take out the contents of your uterus. And so the benefits of this is that you do go in that day and they do the procedure. So you know you're
done.
Yeah.
And what's the time window we're looking at for when this option becomes available?
You can do it at any point.
Oh, okay, cool. I didn't know that. Is it painful for everyone, or is it painful for some people, or like what should one be like prepared for when they go through this?
I think you should definitely be prepared for like cramping. I think cramping does happen. How much does it happen? I think it varies because the cramping is your uterus.
Cramping, like
it's your uterus like contracting, right? So it's like if you're doing the pill abortion for the second medication, that's the whole point of it. So we want it to happen. I think people find it to be a little bit more painful as they're further along.
Gotcha.
Yeah, maybe just having to do with have more content in the uterus as well.
Right. That makes sense.
Yeah.
So if like someone has an abortion today, like should they plan to take a couple more days off from work, or like how long till you feel totally fine again?
Let's say you're doing a clinic abortion. That means you go to the doctors and you take the first medication. That day, for like at least like 6-7 hours, you don't actually feel anything. 6 to 8 hours, let's say. And then they might start to feel some cramping because then your body, there's change happening, so your body's reacting to it. You want to take the day off when you take the misoprostol. Because the misoprostol, the second medication, that's the one that makes your uterus cramp. So that one, you should plan to be off for that day. And then I would recommend, if your job allows you, unfortunately, living in the world we live in, you should try to get the second day off as well. With the pill abortion, the other thing is that you do have some residual spotting or bleeding afterwards. So how much really depends actually on how far along you are as well. That also varies. For the surgical abortion, when they're removing the contents of the uterus, they're sort of doing the bleeding portion that you would have to do with the pill abortion So because they're already taking the contents out. However, you might have some spotting, but much less bleeding. So that's another reason some people prefer that as well, is just to not have like a residual sort of bleeding that happens. So for surgical, you should have the day of the surgery off for sure. You can get pregnant like right after. That's also, there's a lot of like myths around that as well. So you can get pregnant right after. You can. Yeah. But I think you can have some like spotting and some abnormalities as well.
In your period.
On your next menses.
Gotcha. That brings me to the other question, which like both from if you're living in somewhere where abortion might be illegal, or like if you might be in a relationship or a household dynamic where you don't want anyone to find out that you had an abortion. Is there a way for someone to find out?
So that's another reason some people opt for the pill abortion sometimes, because they don't have the ability to be like going to a clinic and then being in surgery. But then there are some people who do opt in for the surgery because they're like, oh, I can say I'm doing something for one day, but then have it done. And then this way, afterwards, there's nothing, unless they are worried about clinic and stuff, because obviously it is associated with your name and your files. But no one would know that you had abortion unless you told them what they found out, because they broke your medical
but like
violations.
They can't like look inside your body.
Oh no.
There's no like blood test. None of that. Right? Like,
there's
okay,
no
that's good.
The pill, the mifepristone, I think after like 24, 48 hours, you're not going to be able to take
No one's going to find out.
So,
Gotcha. My other question is just like, we've talked a lot about like the physical side effects. And I was just curious also, like, I think emotionally it can be a really tough decision for people.
Yeah.
How do you deal with some of the emotional things that could come up?
I mean, like, any decision we make about our body and about our life in a way that, like life, career, whatever that you're doing, is going to change your life, because that is the whole definition of making choices in your life, is that it changes them, right?
Yeah.
And then there's this trope about like, oh, all these people who are just like recklessly having sex and then they're getting abortion, like it's nothing, and it's like, and they use this trope to talk about people who are fighting for the choice, right?
And it's usually like, we were discussing this, but like, this trope is very much like very harsh on young teenage girls.
Oh, yes.
Yeah.
And the emotions of it, I think, is very complex. Like, also, you're taking, like, if you're taking the medication, you're taking hormones, right? You already are, your hormones already are enlarged at the time because you are pregnant. So you do have more hormones. Not to say, like, the hormones made you crazy, but it's like, these hormones are what will control a lot of our emotional well-being. And so when you're having a large force of that
Yeah.
compiled with, like, just your own stress, anxiety, whatever else you may be facing, it might still be difficult for you emotionally, because any procedure, anything you're doing to your body can be difficult, right?
Yeah. The other, like, one myth that I literally heard from a medical provider, which I've later found out is not true, but I'd love to hear your thoughts on, like, how does abortion affect fertility long term? And I've also, this is like so specific, but someone was like, if you get an abortion with your partner, then, like, your body might reject. Oh. Like, and not, yeah.
How would they know?
And like, your body may reject, like, the next time that you're trying to get pregnant with the same person.
Wow. No. I would I would say that I have not heard anything in my medical studies or I've read anything that said that anybody does not have a way to, like, create, like, anti-sperm antibodies, because that's the only way I can think of that you would be able to, your body would recognize whose sperm this is.
Unless you're allergic to sperm in general.
In general, now that's a whole different story, because now that is not specific to the abortion. You know, like having the abortion, like, your body does not know, like, oh, so we don't want this person's baby. Like, your body's not doing that.
So no effects on fertility.
So I will say that about fertility is, they have not found any effects on infertility with medication abortion. What I'll say for the surgical abortion is that, and this is with any surgical or any uterine sort of manipulation, and in that I mean, like, specifically it's the dilation curettage, which is where you take the where you open up the cervix and then you use this instrument to sort of take out the contents of the uterus, which is it's a different type of a tool. So you're not actually, like, kind of like, it's kind of a bad word, but it's not bad, but it sounds kind of horrible. It's scraping the sides of the uterus to release it from the walls. Like, after multiple uses, sometimes you can create fibrous tissues, which can be, like, hard, and then it can sort of lay on the bottom of the uterus, and that can make it hard for, like, even sometimes for menstruation to come out. So it's like a structural adverse event that can happen with the dilation curettage method after multiple times. So that can affect fertility.
Yeah. Good to know.
Not super common.
Yeah. One thing that I just remembered related to your earlier point about, like, the emotions inside of things, and even just, like, any questions about abortions in general, there's a really great online resource. It's called Safe to Choose, like 2 as in the number 2.
Yeah.
And it basically talks about abortion and the rules in several different countries, but offers free online counseling.
Very cool.
For people who might be considering their options, and if they have questions about things like this as well. Yeah,
nice. There's, like, a call line for US. It's called All Options, and so that one is also a pretty good talk line that we used to offer. And it's not based on any, like, religion or any sort of dogma. They just talk to you about your options. So if you want to talk to someone,
Awesome. Okay, so that brings me to the end. Let's talk rapid fire.
Yeah.
Okay.
Yes.
Are you feeling ready to rapid fire?
I'm ready.
Awesome. True or false? Abortion pills are less effective after 10 weeks.
True.
True. We discussed this.
Yeah.
Okay. This feel bad just saying it. You will regret your abortion someday.
False. I think research shows that that's actually not true. You have a lot of different studies that have shown that people don't. I think there's a lot of emotions you might feel, and regret, I think, is a valid emotion that we could feel about any decision, and doesn't mean that, you can feel it temporarily as well. So I think it's all really about you. Plan
B, or the morning after pill, or in India it's called the I pill, is the same thing as an abortion.
No. So if you were already pregnant when you took the Plan B or ulpostrol, all these different medications, they would not do anything to the pregnancy. The most common one that we have, the Plan B one specifically, that's just like a large dose of actually the same hormone that's in birth control pills. So it's just like estrogen, progesterone, like hormone. It's trying to delay your ovulation.
So it prevents pregnancy.
Yes.
It cannot help you if you're already pregnant.
Yeah, no, it will not do anything to your pregnancy if you're pregnant. So
right.
that's the definition of not
Yeah.
abortion.
And what's one sex ed resource that you rely on?
Ooh, I mean, obviously, Talk It Over God. That's the obvious one. And then, actually, I think I'll shout out my friend Nicole, who does Learn Body Lit and that's the username on Instagram. Does a lot of conversations about like menstruation and about menstrual dignity awareness work, and obviously Global South Coalition and Crime Menstruation for our work as well on menstrual dignity. But for her specifically, she does a lot of work raising, just understanding menstruation. I think that's a very important starting point for all humans, regardless if you menstruate or don't. And I think it leads to us understanding a more holistic picture about anything related to SRHR.
Yeah. Well, that brings me to the end. Thank you so much, Millie, for talking about this topic. I learned so much from hearing, and I know a thing or two about abortions, but like some of those technicalities, I think, can be daunting to like wrap your head around it, especially in the moment, especially when you're trying to make a big decision about it. So really appreciate you taking the time to speak with us today. And for all of you watching, please don't forget to like, comment, subscribe, save, share, do all the things, press all the buttons, and don't forget to tune in next week. What even is everything?
Women's fertility starts to decline around 35 years old. And so the doctors are able to take all of the eggs that are ready and then put them in a special freezer to keep them for later use.